No way.
Electronic health record adoption in small office settings. Our presentation entails introduction, why and who implements electronic health record, meaningful use of electronic health record, advantages of electronic health record, issues and challenges of electronic health record, barriers and benefits of electronic health record adoption, as well as financial aspects, and our summarization. Why implement electronic health record? Electronic health record system is an official health record for an individual which can be shared among multiple facilities and agencies. The widespread use of EHRs in the United States is inevitable. EHRs will improve caregivers' decisions and patients' outcomes. Once patients experience the benefits of this technology, they will demand nothing less from the providers. Hundreds of thousands of physicians have already seen these benefits in their clinical practice. Electronic health records provide instant access to information about a patient's medical history, allergies, as well as medication. Who implements EHR? According to the National Center for Health Statistics data brief, in 2011, 55% of physicians had adopted an electronic health record system. About three-quarters of physicians who have adopted an EHR system reported that their system meets federal meaningful use criteria. 85% of physicians who have adopted an EHR system reported being somewhat 40% or very 38% satisfied with their system. About three-quarters of adopters reported that the use of electronic health record system resulted in enhanced patient care. Nearly one-half of physicians currently without an electronic health record system plan to purchase or use one already purchased within the next year. Meaningful use of electronic health record is to achieve significant improvements in care. The meaningful use requirements will include providing patients with electronic versions of their health information. It's a core requirement of the HITECH program, which is the high-tech program. This program is part of the government's larger efforts to move towards valuable-based healthcare through increased access to clinical information for all stakeholders, thereby improving quality, patient outcomes, and cost containment. In order for providers to demonstrate meaningful use, understanding the criteria and process is critical, as it is in selecting the right technology partner, such as Cerner, Epic, so forth and so on. Providers must have electronic health record technology that meets all federal rules. There are many advantages of electronic health records, such as EHR accomplishment will give professionals a great source of update patients' vital signs, plot and growth chart, and to receive any lab test results. Another meaningful use of EHR is to check insurance eligibility and submit claims electronically, and that's a great money saver. One of the most important advantages of having electronic health record system is to provide automatic electronically generated an indication of any allergy that a patient might have. And it also gives opportunities to the professionals to prescribe their medications electronically. There are many issues and challenges of electronic health record, which may lie ahead for regulatory implementation of these rules are as follows. The success of the meaningful use incentive programs will depend to some extent on the number of eligible providers who choose to participate. Many critical providers are not eligible for incentive payments, including certain behavioral health, post-acute care, long-term care, and home health centers as standalone entities are also not eligible to participate. Most Medicaid agencies do not have the necessary infrastructure in place to implement and oversee meaningful use incentive programs. To the extent the electronic health records improve healthcare quality and efficiency, the meaningful use incentive program may worsen disparities by omitting certain safety net providers who serve a substantial number of minority patients. There are also barriers and benefits of adopting electronic health records, such as financial, technical, and which are the three categories. Barriers are lack of capital investment, maintenance costs, complex contracts, lack of time. Some of the benefits are reducing transportation costs as well as staff expenses and increased revenue. The technical barriers are concern over the technical ability to use the electronic health record, lack of training, creating a migration plan, a lot of physicians being resistant to change, meeting technical clinical requirements, usability, and difficulty or inability to evaluate and select electronic health records. Practice procession of electronic health records. Some of the benefits of adopting electronic health records is it eliminates chart pools, improve decision making, access to information. Some of the barriers are concerns over privacy, lack of evidence, and effectiveness, difficult building a strong business case, concern over loss of productivity, technology burdensome, and lack of support from practice physicians. Financial aspects of electronic health record adoption is although a growing percentage of physician practices are adopting electronic medical records, a large gap persists in adoption rates between the smallest and the largest practices. Small practices are not adverse to adopting technology. Electronic health records, financial costs, and benefits can affect the rate at which providers adopt them, while quality improvement benefits can affect patients' health, which may then result in financial benefits for payers from rewarding downstream expenditures, especially for hospital and emergency room services. Other financial aspects of EHR adoption: better cost and benefit data on EHRs and solo and small group practices can help policymakers formulate financial and non-financial incentives designed to achieve an acceptable rate of EHR adoption and higher levels of quality insurance benefits at the lower possible cost. EHR-related costs for hardware, software, information, system staffing, and external contractor services, installation, training, abstraction, productivity loss, and telecommunication. There are many reasons to act now. Starting in 2015, if an hospital isn't meaningful users, then they would be subject to Medicare payment reduction. This will also be the case for hospitals that receive incentive payments in prior years. Receive Medicare and Medicaid incentive funding and to avoid penalties. Meaningful use incentives will be based on percentage of the government's Medicaid or Medicaid claim. Government will offer cash incentive payments. There are many technical supportive reasons to gain incentives will come from HITECH Act. If your practice demonstrates meaningful use this year, then you can receive incentives as high as $21,000. As hospitals will be paid based on cost reports, eligible providers can receive incentive payments before they have begun to use meaningful use certified health records. Another reason to act now is Dr. First has a cheap solution named Arcopia, and for just $7 a day. It's very useful for physicians who don't want to spend too much money. It will speed up daily processes from cutting down prescription processing time to reducing time spent looking for a patient. In a nutshell, it means making meaningful use of electronic health records to meaningfully improve health outcomes. Over the years, much data has been gathered to identify many ways meaningful use of electronic health record results in better health care while reducing costs. If these providers do not adopt the EHRs because of their omission from the incentive program, the opportunity for health information exchange will be lost. Furthermore, their patients will not receive the benefits of greater quality and efficiency that EHRs are expected to bring.